Hello everybody and welcome to the Thursday edition of Video Clips. Over 2 million Americans have been diagnosed with schizophrenia. That's a big number. And these people suffer with hallucinations and delusions. They're typically treated with high doses of antipsychotic drugs which have very severe side effects. And those side effects include things like tardive dyskinesia, which is involuntary movement of the tongue, the face, the trunk, the extremities, severe weight gain, increased risk of several diseases, and shorter lifespan. Patients dislike the drugs, and most of the time they will stop taking them unless they're in a confined psychiatric hospital where they're forced to take medications. But studies show that within 18 months, 75% of all schizophrenic patients discontinue their medications. A new government-funded study shows that focusing on drugs as the treatment modality for schizophrenics is a misguided approach, and concluded that patients who take lower doses of the drugs and instead are treated with more talk and family therapy fare better than those who are given high doses of drugs. Well, my gosh, it is about time we started taking a look at how we treat schizophrenics in this country. So in Lapland, Finland, this area used to have one of the highest rates of schizophrenia in Europe, but today the long-term outcomes for schizophrenics in Lapland are the best in the world, and the incidence of schizophrenia has dropped. It's almost non-existent. Several years ago, treatment teams began using patient-centered approaches that included low doses of medication only when needed, and in a few minutes I'm going to tell you how low. This is just unbelievable what these people have done here. Listening to patients, the researchers hypothesized that the hallucinations and delusions could provide information about how to help patients, and very intense family therapy. Decisions about care were made with family members, and the patient provided input too. Many chronic patients were discharged from hospitals, and at the end of 5 years, just 61% of patients were asymptomatic, and only 18% were on disability. Today in Western Lapland, schizophrenia is defined differently. Instead of labeling it as a mental disease, mental health professionals talk about it in terms of frayed relationships with family and members of the community, which is why it is so important that the therapy involve particularly family members and sometimes other people too. Today, the preferred place for patient meetings is the patient's home. 2 to 3 staff members attend, and they end up comprising the treatment team. The goal is to get everybody talking, including family members and friends who also become part of the team. Therapists are respectful. They consider themselves guests in the patient's home. Psychiatric drugs are not even discussed in the first few meetings. Instead, the team helps to work with the patient to get him or her to be able to do daily activities like sleeping, bathing, and if they're coming along and beginning to integrate themselves back into life, there aren't any drugs prescribed. The therapists report that the patients are not violent. They don't need to be restrained, and that's another common thing that's done to patients here in this country. From the beginning, patients are made to feel that the problem is solvable. The therapists say, yeah, we've helped a lot of people get well. The expectation is that people are going to get well, and you right now are going to get well. Think about the difference between that and here in this country where mental health patients are told, you'll be sick for the rest of your life, we're going to drug you up, and particularly schizophrenics, this is what happens to them. Since 1993, not one single first episode schizophrenic patient in Western Lapland has had to be hospitalized. The area's spending on mental health is the lowest of all health districts in Finland. Recovery rates are high. At the end of 2 years, 84% first episode patients had returned to work or school, and only 20% of all of them were taking any drugs at all. And what is truly amazing is that the incidence of schizophrenia is disappearing. Families are so comfortable with this form of care, and they have so much trust in the system that nothing bad is going to happen to their family member, that they call one of the clinics at the very first sign of psychosis. And because intervention begins really early, patients only have symptoms for an average of less than a month, and almost none of them turn into full-blown schizophrenics. The incidence of schizophrenia has dropped 90% since the beginning of this program. Now, let's contrast that with what happens here in the United States. Patients here experiencing early psychosis, which is the first break from reality during which the patient starts to become delusional, they don't get early intervention. In fact, the average time between the first episode and when anything's done is about 18 months, and by this time, many, if not most patients, have developed full-blown schizophrenia and are treated with large doses of drugs and often confinement in institutions. So the new U.S. study that I referenced at the beginning of this talk here not only involved intervention, but an attempt to duplicate some of what was done in Lapland by focusing on the treatment being administered by community clinics instead of psychiatric facilities, which was a good move. The research team was led by Dr. John Jane, chairman of the psychiatry department at the Hofstra University Medical Center. The study, which began in 2009, involved 34 community clinics in 21 states, which were randomly assigned to either offer usual treatment is horrible, it's just load them up with drugs, or combined therapy, which is low dose of drugs and talk therapy and family therapy and that sort of thing to schizophrenic patients. Clinic staff members were trained to deliver the therapy, which involved using 3 approaches, which these included assistance with work and school, education for family members to increase their understanding of schizophrenia, and one-on-one talk therapy. The objective of the talk therapy was to help the patients to build social relationships, to reduce their medications, and manage symptoms. For example, some patients can be taught to address the voices they hear without drugs, either by ignoring them or talking back. Patients have hallucinations during which they see imaginary people, and they can be taught to ignore them too. And I don't know how many of you saw the movie A Beautiful Mind, which was about John Nash, who was a very famous schizophrenic patient and won the Nobel Prize for math. And he got this type of therapy. And I don't want to spend a lot of time on this, but you might remember at the end of the film, he gets the Nobel Prize and he leaves the auditorium and he's out in the bigger area talking to somebody, and he asks the one person, "Are you real?" just to make sure I'm talking to somebody who's real. And then he sees the usual imaginary people over off in the distance, and he just chooses to not go talk to them. So those are some of the skills that you can instill in a schizophrenic that allow that person then to, in John Nash's case, teach at the university, win the Nobel Prize, move back in with your wife, have a normal life, and that sort of thing. The subjects of the study were 404 people with first episode psychosis, most of whom were in their late teens or 20s, so early intervention was part of this. Clinicians in both groups rated patients using standard measurements to determine how well they were getting along with others, how well they were coping in school or at work, and other facets of life. On average, interestingly enough, the subjects assigned to combined treatment scored worse at the beginning. Sometimes that happens when you randomize, but in spite of that, both groups showed improvement, but the ones who did the best and improved the most were the ones that were in the combined therapy group. They functioned better overall. And those people were taking much lower doses of the drugs too. Now, the study falls short compared to the program in Finland since it advocates drug therapy for everybody, and in Finland, drug therapy is reserved for only a tiny percentage of people where there is no other option. But the hopeful part about this is there is more therapy involved and the families are included. And actually there's some hope that this might make a difference in the way treatment is handled. I mean, one of the big problems we have in our country is while lots of studies may show that we should be doing something different, we often don't do something different. I've come at you with a lot of those results too. The Centers for Medicare and Medicaid Services included an endorsement of combined therapy in its guidelines that were issued on Friday, October 16th, and Congress is working on mental health reform because there is so much concern over all of these mass killings and side effects of psychiatric drugs. So we'll hope that this new information finds its way into those reform efforts as well. I think what this really shows, however, and particularly the contrast with the Lapland, Finland area, is the psychiatric profession, drug companies, and public health authorities have a lot to account for. Together, these groups have been able to sell Americans and others living in westernized countries a theory of the cause of mental illness that's incorrect, that involves spending billions of dollars a year on useless treatments, mostly drugs. The drug companies manipulate the trials. I mean, just a couple weeks ago, I did one of these video clips on the reanalysis of the Paxil data that showed that it was misrepresented. They out and out lied. It was fraud. But nonetheless, this has been used to allow the drugs to be prescribed to millions of people. And in 2007, just to give you an idea of how awful this is, the United States spent $25 billion on psychiatric drugs, more and even more on the doctor visits that were billed in order to prescribe the drugs. That is bigger than the gross national product of some major countries in the world. Now, the public's been told that this is a great investment, that this is really worthwhile. But today, 850 adults and 250 children are placed on disability every day as a result of taking these drugs, and mental illness. So I'm astounded that public health authorities and the medical profession and the drug companies can continue to spin the story that they're helping people. These people must be incredibly ethically challenged. I don't know what else to say about it. Well, up until now, a few brave psychiatrists have spoken out. They've paid dearly, and some of them have done alternative programs. And by the way, a lot of this is outlined in Robert Whitaker's book, Anatomy of an Epidemic. He's speaking at our conference next week. You should be there to hear it. But a lot of these people, they've lost research grants, they've lost academic positions, they've been marginalized by their peers, and in one of the most extreme examples of how vicious it can be, the American Psychiatric Association tried to take away Peter Bregan's medical license after he said on the Oprah show that nobody should take these drugs. He's also been an expert witness in the Prozac trials. He was able to keep his license. It cost him a lot of money, and of course it's horribly embarrassing and time-consuming and frightening that you could lose your livelihood. Well, to come back around to this study, I'm hoping that this study is the beginning of dismantling this whole awful monopoly that drug companies, psychiatrists, and public health have on mental health treatment. I mean, we should just blow that system up and start over again, and I don't see that happening, but at least we're making a little progress here. All right, that's all for today. As always, pass this on to anybody who you think would enjoy watching it, and I will be back to you next Tuesday with more news.